Okay, we're live.
Okay, nice.
Welcome to new episode Rise and Clarity Insider. Um, I'm having the pleasure to my guest today is like Dr. Bronce, psychologist and practical in like different uh, kind of helping people through their mental health. Welcome, Dr. Bronce.
Good to see you on. Thanks for having me.
Yes. Our subject today is like healing, the art of science and the science of healing.
Mm.
Um, so I think you're the best guest to talk about this, especially with your practice and considering that healing tools and processes have a different aspects and defined through the uh, approach, like different people have different approach of it.
Mm.
So let's start by like trying to define the healing process, or if there any like equation, or how do you help exactly your patient through the healing process.
Yeah. So I think kind of, maybe broadly, what I think about healing is, maybe the term kind of wholeness and, kind of an integration, maybe kind of mind, body, and how that kind of comes together and how you kind of live out certain aspects of your life. I think with, mental health, generally, historically, health and wellness has been kind of tied with symptoms, so that certain people would think, healing would be, returning the patient back to the previous level of care. And I used to work in, psychiatric hospitals and inpatient, and they'd come in with certain symptoms, and if you could alleviate the symptoms, and as to say their emotion regulation kind of returned. Maybe they weren't having, panic attacks. Then they were kind of ready to be discharged. And so it's been thought about in terms of symptom relief, but over time I found that to be a little limiting. So for me, I think kind of the whole person, to me, you're kind of looking at aspects of, work, love, play, energy, sense of aliveness, kind of connection to what's important to you, right? And kind of for certain people that might be, a passion for living in a certain way that, let's say if you've been exposed to trauma, aspects of how you normally function or how you feel about yourself and where you're at in life, sometimes that's kind of taken from you. And so, or if, if anyone's ever been through kind of like a really painful breakup,
Okay.
somebody may, come to see me because they're in such emotional distress and they're not sure what to do. And so, kind of healing, for them is kind of getting them back into different aspects of their life, being able to go to work again, maybe not having, panic attacks in various ways. So uh, that's a little bit how I think about healing. I think kind of a connection, um, kind of helping people internally in ways feel more whole. And how do you help somebody live that out? I think kind of mind, body, spirit, I guess, and the integration there is kind of how I think about healing.
So it depends on each case in general. Like everyone has a different story.
I think so.
And
Yeah. I mean, that's why I think, previously mental health probably had a problem with that. And they would say, well, how are we going to define that? How would we, define a criteria to let somebody stay out of the psych hospital? And, alleviation of symptoms is how they did it. But, you know, kind of what you'd find out is, somebody would come in, 10 to 14 days. And if they came in, painful breakup, let's say that they were staying up late, not taking care of themselves, panic, not going to work, not getting out of bed. You could stabilize them, and then kind of you can. And in the hospital, most people are putting on medication, so you could stabilize the anxiety just to some degree. But does that mean they've healed? Yeah. So I do think I think of it as a very kind of individualistic kind of endeavor, which I might have certain definitions. Say the one I mentioned in terms of how I think about just probably the three biggest areas in anyone's life, kind of work, love, and play. Generally, it's been thought about in terms of just work and love, but you can be doing really well at work. You can be pretty good at relationship and whatnot, but if you're not kind of having an aspect of play, enjoying yourself, that would need to be kind of looked at. Um,
Yes.
yeah,
So related, to define the symptoms first, as I understand, and then you define the unique framework to the patient, and in that way, maybe you give them a mindfulness technique
mm,
or mind body technique. This is the
yeah,
maybe the power of the mind in the healing
uh-huh.
process. So they can start using it
Mm,
as a like solution indirectly, because like
yeah,
some people they don't know exactly what they have.
yes,
Like
yes, yes,
if you tell them that, okay, you
yeah,
have to be healthy, like
yeah,
how, and
yeah, yeah,
why.
yeah, yeah,
So
yeah, yeah,
they don't know. So
yes,
example,
yeah, yeah,
if I start my own healing journey,
yes,
writing, like if something happened to me, writing down like all
yeah.
the symptoms and start healing by myself, finding solutions without even defining the concepts. Day
Well,
one, day two, day
yeah,
three, day four.
yeah,
So
yeah, yeah, yeah,
I was like approaching, try, try to defining healing.
yeah, yeah,
Sometimes, because
yeah.
sometimes the symptom, there's no symptom, absence of
Ah,
symptoms.
mm, mm.
So
That's interesting. Yeah,
yeah, so
yeah, yeah,
sometimes it's absence of the
yeah.
symptom.
Oh, yeah,
How
yeah, yeah,
you
yeah, yeah,
define or you find that there's some
yeah,
dysfunction in the body system,
yeah,
or uh, like try to explain maybe the
yeah,
definition for the patient, because the patient they don't know exactly the definition or like the science of healing. That's why I'm trying to be
yeah,
approachable, at least
yeah,
to find this hidden, hidden definition
yeah.
of
Well,
healing.
and that's just I think that's a really, but like in a sense, you'd probably have to go, you know, Google it or Chat GPT it or something where hey, you know, give me five definitions of healing, right? And I imagine you could find a textbook on it in some fashion, but I do find it kind of individualistic for each person, and that would be interesting. If someone came to see me and if they told me, and I mean, nobody's going to come in and say, "Hey, here's my symptoms," so to speak, in that kind of dry textbook kind of way. But if someone came in and kind of said, basically, in their own words, that they don't have any symptoms, I'm kind of like, well, what what would they be coming to get help for,
Yeah,
right? But
maybe.
the way you phrased it was very interesting, and I liked how you kind of said that. Hey, there are times basically where hey, we might not understand something,
Yeah,
but there's something, and that I would think about it. As say anxiety, right? I'm like, okay, so we're anxious, but we don't know why, and what do we do about that? If I don't know where it's coming from, or what do I do? As you mentioned, well, maybe I would say, hey, why don't we set up a meditation regimen? You know, 15 minutes in the morning when you get up, 15 minutes before you go to bed. So at least you're starting your day with less stress and anxiety. you're finishing your day with less stress and anxiety. Let's see where that gets us. It doesn't tell me what's generating the anxiety, but it would kind of help begin to orient. Well, maybe it cuts it down. But I think I think you hit upon, maybe you would kind of start to write something down as part of your healing journey. To tell me a little bit more about what your thinking was there. 'Cause I think you have something there.
Yes. I started for sure, like I had anxiety, and I
Yeah,
started like I want to do something. I want to do some action because I
yeah,
didn't know
yes, yeah, yeah,
how to
yeah,
deal with it.
yeah,
So just like day one, the symptoms, what I have, and just like try to heal it in uh, in a doing action, like go out,
yes, yes,
having some walk,
yes,
go to the, I don't know, meet people, talking to
yeah, yeah,
people.
yeah, 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 yeah,
So I
yeah.
was like testing myself
Well,
how to
that's
do
nice.
that without
Yeah, yeah.
even defining what's going on because I
Yeah,
didn't
well,
know what's
yeah,
going.
no,
So
that's good because in a sense you got an idea that the symptom, right, would be the anxiety, and then what, how do I help myself figure out, almost twofold. I think about things, right? It is then, and I at some point I can give you an example. Somebody who came to see me in terms of how I used to think about therapy versus a little bit more about how I think about it now. But you have some anxiety, and so you start to write down things that you notice or think about in terms of the actions, right? The action steps in terms of uh, I'm anxious, but I want to be not anxious, and what moves the needle in that direction. And so I could start writing down my thoughts. I could observe what happens when I go out for a walk, what happens when I meet people. It's a very intuitive kind of way to start to pay attention to what happens to you. You could write it out in terms of, what pay attention to your thinking, right? So one of the things that I might help you do, right, with that writing, the journaling, so you kind of said, hey, I'm anxious. I want to not be anxious. So let me write about it. So that could be part of your personal healing journey, an aspect of it. You mentioned going for a walk, right? So if you do that enough, that's going to release serotonin and dopamine, the feel good chemicals. So that could be a component of it. You go meet people, and if it was people who you care about, they care about you, and there's a warm connection, that might help the anxiety, lower a little bit. So just by what you laid out, you've got pieces or factors of what you're healing, or what how I kind of phrase it in terms of like a well-being equation, what it begins to start to roughly look like, right? But you have a process there in terms of you write something down, pay attention to it, and you begin to play with it and what you notice, right? Which is very good. It's
yes,
very, very nice.
and updating through the journey because like some people they think healing is a destination. I go to you, look,
Yeah, yeah,
doctor, I
yeah,
have
yeah,
this,
yeah,
this,
yeah, yeah,
this.
yeah. Yeah, yeah,
You
yeah.
gave me the solution, bye. But this is not
Yes.
like
Yeah,
this is not
yeah,
the case.
yeah,
It's
yeah. No, good, good, good.
it's a
Yeah,
full
yeah, yeah,
journey. It's not a
yeah,
destination.
yeah.
So it's
Oh,
I
yeah,
was yeah, I was trying like one time
yeah,
I
yeah.
was trying to define
Yes,
what's going on with my mood as an example. This is
yes,
another problem.
yes,
So I didn't know how to do.
yeah,
So the first thing that I did is trap my mood. Today I'm
yes,
off, tomorrow I'm good.
yes.
And
Bingo.
I just like
Yeah,
try to I draw
yes,
my mood tracker
yes,
in a way that I
yeah,
can know which days that I was like off and why,
yes.
and start putting the
Oh,
results.
bingo.
And in that
No,
way, like even without
yeah,
knowing the science out of it, you know what I mean?
yeah. Well, no, no.
So
That's really good.
that's why, yeah,
Right,
that's why the reason we're doing this live is like to helping people,
right.
even if they don't know science, is the
Yeah,
action of asking
and attention.
questions first
Yes,
Yeah, and ask yourself what's going on, even without symptoms. Because like some people
Yeah.
go to you,
Yeah.
doctor, like I'm fine, my job is good, my personal life is good, everything is
Yeah.
good, but like something off. I feel myself like something not good.
Cool.
So
Yes. Yeah.
if they start asking why, so
Yeah.
and
Yeah.
then you will approach them in a way like, okay, from where you start. So because like people really they don't know
Yeah.
exactly
Yeah.
how the game in general.
No, no,
So
no. Yeah.
yeah, so the customized like for each person has his own frame. But the
Yes.
question is like maybe the action or the question of like start asking is the start of the
Yes.
healing process? Is it the
Well,
start?
well, it can be right. No, and I think I think personally, it needs to be in the healing equation. The kind of the philosophical kind of questioning of you know almost like what's going on. But that then eventually you might hit upon kind of, hey, is there meaning in my life? What's the purpose of my life? What are my values? And how do I live those values out? And what are the steps to do that? But in the mix, you hit upon something very important, in the tracking, because if I don't know what's causing the anxiety, and I go out and do certain things, it's going to fluctuate. And if there's a day where, hey, somehow I don't have it, but like I can have somebody who has anxiety during the week, right? And they come in to see me, and they've not done anything different. So the relationship's going okay enough, but whatever they normally do is going okay enough, but they're still kind of anxious, as you mentioned, and they might come in to see me, and on that day they're like, "Hey, I don't know why I'm feeling better. I don't know what's going on." Right? So one possibility is the person comes in, and we're having a conversation and in very meaningful ways about what's important to them and trying to help them understand, whatever's going on in their life, the anxiety, and that focus on them and the discussion. Um, that in of itself for certain people can be very meaningful. And yet if they don't have enough social connection, let's say they're kind of don't have very many friends, don't have social outlets, push too many hours at work, kind of overloaded, overstimulated, stressed out. Um, let's just say that they did go through a breakup, um, but they don't understand kind of the importance of kind of that lower the physiology, have an important slower conversation, and that could be an example of where someone doesn't understand the symptoms and what helps them and what doesn't. So I think it does start, I think, with questions in terms of kind of at a base level in terms of whatever the frustration is. You know, one of the things I look at is just kind of the mind in conflict, right? And so if you came to see me and you didn't know what the anxiety was about, one of the things I would help you do is just pay attention to what is your mind, what do you do in relation to it, right? So you might be geared towards, hey, I'm going to write all this stuff down. I'm going to go do something. And it's like, well, okay, you may have a mindset to go out and take care of something. But, what does your mind do in terms of, let's say you're taking care of it, trying to, and you get more anxiety. I would help you pay attention to kind of what your mind does. And you know, because sometimes the mind might ease a little bit in terms of, hey, you now found a little bit of process that you think would be helpful to you, and you have a way of going about something, and that might ease the mind. So you might have less conflict, so to speak. So I help someone pay attention to how the frustration manifests in their life, right? So it is kind of a it's kind of a tricky thing. Like I can tell you, various different components of healing, so to speak, or one's well being. But I think you hit upon earlier. It's all a little different. We all come from different backgrounds, different cultures, and we carry stuff with us differently than the next person, and how that manifests in the particular environment we're in is kind of interesting.
Yeah.
Um, but you have to, but I think you do need to be able to start just with some questions, right? Questioning
Yeah.
oneself.
And
Right.
also, another point related to the subject is, like, we start recovering and we start the process of healing,
Yeah.
and then, like, 5, 6 days, 7 days, like, something off again, because
Yeah.
they don't get
Yeah.
enough recovery.
Yeah. Okay. 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 Okay.
So what, I don't know what's happening in the brain, but
Yeah.
they think themselves they are good, everything go back to normal, and then
Yeah.
boom, off
Yeah.
again.
Yeah.
So is it
Yeah.
is it like they don't take the full journey of recovery, or like they don't maybe know the techniques? Because there's a lot of common techniques, and like breathing well, like deep
Okay. Yeah.
breathing, nutrition, like everyone knows the standard
Yeah. 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 Yeah.
recovery process or whatever.
Sleep. Well, sleep. In essence, that there's a
Sleep, yeah.
part. Sleep, exercise, diet. Like those are three things. To have kind of mental clarity. You know, those are three things the body needs. Now, the interesting thing is, if somebody comes in with a lot of anxiety, their relationship seems to be okay, their work seems to be going okay, you know, that they can go out and participate in some social activities, normal activities of daily living, let's just say, and they're able to enjoy them to some degree. But they notice that they're still anxious in a way that they're not used to. But they can't tell me why. And again, their sleep, exercise, and diet is solid. They're good with those things, right? What that begins to orient me to is, all right, there's probably something. Well, probably there's a likelihood. I should put that way. There's a likelihood that something physiologically, is going on, right? So I can have somebody with like thyroid condition, low vitamin D, low B12, right? Things that will be known to cause anxiety.
Mm.
Sometimes slow someone down, but they could start to slow down, but then they might be anxious about that. Right. So one of the things, I often do is part of the healing process journey, as I have someone, hey, just go to a medical doctor, your primary care physician, run a blood panel, and let's just see kind of where your numbers are, because, if there's something physiologically going on, right? Like I can talk something to death, but it doesn't mean it's going to dent it. Right. So
Yeah.
there's an example of where the healing, needs to, I think, from a holistic, mind, body, spirit, in terms of, what goes into those things. Um, so theoretically, I'd like everybody, to when they come to see me, I'd like to know, hey, can you get me the numbers? Can you go out and get a, from your primary care, just go get a blood panel and just let's look at those a little bit. And I don't make everyone do that, but it helps my job in certain ways to know where the numbers are, because if someone's depressed and they don't know why, and I look at, kind of what the science shows as kind of typical contributing factors, and it doesn't hit any of those boxes, then I begin to think about, okay, maybe there's something physiologically, kind of going on. Um, yeah.
Yeah. So okay, so let's try to simplify a little bit. Uh, okay, so I was trying
Yeah.
to frame the healing process in a way to be applied theoretically to the
Yeah.
patients. But
Yes.
as I understand after the fact that
Mhm.
everyone has a unique
Yeah.
symptoms related
Yeah.
to his case or her
Yes. Yes.
case,
Yes.
and then yeah,
Yeah.
and then you define after how it goes with the techniques, with the solutions. So in like what are your thoughts on like integrating or like implementing some traditional, like practices as a
Yes.
proactive
Yeah. Yeah.
system, in a
Yeah.
way, like as like let's take an example like natural products with conventional medicine as an example. So how do we practice like as a proactive steps in order to just not having uh, a bad results, like as anxiety, as
Yeah.
stress,
Yeah. Yeah.
or
Yeah.
having like depression?
Yeah. Well, I think when I first started out, like I'm trained as a psychoanalyst, right? So part of the healing journey there, would be to help the unconscious and what they're not aware of become more conscious, right? So that whatever is affecting them that they're not aware of, and helping them understand why that would be. Um, but then say with the sleep, exercise, and the diet, what I can tell you there is that's a foundational piece of anyone's health and wellness. So that's a piece that I can hit upon very early and help people say, hey, look, if you're anxious or if you're depressed, I want to run through, what their sleep hygiene is like. I want to know, are they eating a healthy diet or are they eating a lot of carbohydrates, sugar? Are they not eating enough, dehydrated, staying up? One of the things I have is like I'll have a lot of students who come to see me from Yale, right? Some of them are like in a school of management, and so it's kind of a high stress environment, and inevitably I get one or two graduate students a year come to see me, and a lot of times they're just kind of driving themselves to do all these things all the time. They got to be the top because they got in, right? They're very driven, and they're not sleeping all that well, right? And so I think as I continue to do what I do for a living, and eventually I began to pay attention to the sleep, exercise, and diet as foundation. Because if I want to think through other problems, let's just say I came from a very kind of chaotic family environment, right? And let's say that was driving some of my problems. Well, take whatever X, take whatever those problems, would add up to X, let's just say, right? And then if I'm not sleeping, eating, take care of my self care, those problems begin to multiply. So one of the things I can do, or even with the meditation you mentioned, so sleep, exercise, diet, and then I can help somebody, with their breathing, meditation, kind of a system to help their physiology if they're anxious, lower, and watch what their mind does with whatever comes up as they're meditating, right? So that would be another aspect of that I could help somebody do in the healing journey, right? But there are certain people who have no interest in it. And meditation's been proven to be effective, right?
It
Cutting down
because
anxiety. That's not a question, right? It's been proven scientifically to help. What I mean, and so if somebody comes into my office, we know what's happening, and they got a panic attack, right? I can help them slow down and help them think a little easier and breathe. But it takes practice, right? And a lot of people, it's like, okay, they're going to want, some medication to take the edge off. I'm not opposed to that, right? Um, but some people are so scared of the anxiety that they don't settle down. So I think what you're hitting upon is like and my situation. It's like it's good we're having this talk because, in a sense, I would have to come to you, right? And I got a whole book on this. It's laid out, but it's
Yeah.
really not kind of succinct and in two paragraphs tell me what the healing process is and how do I, you know, how do I make that scientifically user friendly for everybody, right? There's probably people out there who've done that a little bit, I suppose. But I almost have to come to someone like you who will do what we're doing now in terms of
Yeah.
you're listening and you're tightening it up, right?
I was trying to help
Yeah,
people by
yeah,
updating my journey, problems and solutions at the same time. Like
yes,
every problem that I hit,
yeah,
I try to find a solution through a whole journey. Writing is taking the
yeah,
big part,
yeah, yeah, yeah,
and then do some action applying. As an example, like
yeah, yeah,
I was discovering lately that the phone is a problem.
yeah, 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 yeah.
So the phone brings a lot of problems. So how to quit your phone? And I create
Yes,
a product like offline is a new luxury, which is the new form of communication and healing process
yeah,
and finding yourself is without using the phone. Try to
yes,
connect to the
yeah,
nature as an example. So the product
yes,
itself is been has been updated through my journey,
yeah,
which is
yeah,
helping myself and
yes,
my people
yeah,
around me to find their solutions, even without like defining scientifically or
right,
exactly what's going on.
yeah,
So maybe I have the practice and how to deal with it, and like you can relate it scientifically what's going
yeah,
on. Like you try, to give me some frames,
yeah,
try to define the
right,
situation.
yeah,
So the quitting the phone is a big part,
yeah, yeah,
and
yeah, yeah,
the
yeah,
other form of recovery program is the like from the anxiety. So I
yes,
was building anxiety recovery program
yes,
through like 7 days,
yeah, yeah,
and then the 7 days have been updated through by time.
yeah,
And the other service that I offer is like challenging myself within 7 days to build some confidence. So this is
yeah, yeah, yeah,
helps
yes,
exactly with like day one, day two, day three, and sometimes um like you're off, like you take
yeah,
2 days off.
yeah,
As I said before, I
yeah,
burn out like recently. I just
uh,
like sleep for 2 days,
yeah, right,
without even doing like any step.
yeah,
So
right, 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 yeah,
maybe this is help
yeah,
exactly as like the service. And I wish that I can generalize like having some standards to the
yes,
patients,
yeah, yeah,
like try
yeah,
to apply as in like recovery anxiety program, building confidence and like
yeah,
quitting the phone. So I was like aiming, the
yes,
reason of this live, like aiming to standardize or
yeah,
try to find a frame
yeah,
for the patients, try to apply, try to do something, try to use the techniques in order
yeah,
to help them to overcome their obstacles. So how do you see it, like through the
well, yeah,
journey? Yeah,
well,
how's like what's your opinion about that?
well, so you know what I can kind of so I'll throw out some thoughts here, in terms of just in regard to what you're talking about for you. How would
Okay.
you build that out as far as to others, right? That's kind of what you're thinking about. But so you're anxious, so you're not sure why and what to do, and so you decide, hey, I'm going to start writing some things down, right? And in the process, you notice that the phone has been a problem, right? And so that that is what we're seeing in today's day and age, right? That everyone's attached to technology, everyone's using it, they're getting overstimulated, right? And that it's happening younger and younger as well. Each generation is kind of using technology more and more. So there's more disconnection, there's more loneliness, more anxiety because of the amount of use. So it's not like the technology is bad, right? It's the amount that we're using it. So what you hit upon is you could cut down on the amount of the phone usage in certain ways, if I understand you. So I could say, hey, let's take some of the things that you've said and let's help you live it out, right? So I'm going to say, hey, in the morning, right? Let's have one of the things you mentioned. We'll go for a walk. So let's have you, get up get up, go for a walk, and get your heart rate up, get your breathing, the oxygen in your blood, and that alone helps. A lot of people feel a little less anxious. Come home. I'm going to have you meditate for 15 minutes. Right? Just meditate, let your mind go wherever it goes. You might keep a pad of paper near you, and you could write down some thoughts as you do that. Put the phone, put the meditation rather down. So you're using a meditation app, so you put the phone down, or um, into the breathing and whatever else you feel more subtle as well. And then you could write out what you notice through the writing process, right?
Yes.
And then let's say at that point you got to go to work, but you've then implemented a strategy to how to be less anxious, right? And that process, if you did it that way, I bet you that would help 85, 90% of the people if
Yeah.
they honestly did it, right? Um, so in a sense, I- you know, I've hit upon walking, getting outside, being in nature. You mentioned, right? So you're getting outside. You say you're putting your face in the sun, right? So you're getting some vitamin D as well, right? That's been known to help, with depression, right? So there's things that are out there you could do that you could standardize, right?
Yeah.
And all that would be very helpful. And I'm saying keep doing it, but then I might have a situation where okay, but that's all very helpful, but what if someone's problems were generated in relation to family conflict, right? So that all those things that I help you do cuts down the anxiety, but maybe it's not doing anything for the root cause of the anxiety. And let's say I gotta then help the person look at family dynamics. With the person I mentioned, kind of like the business school, right? Um, so the father's very hard on them, very driven. Nothing's good enough. A lot of verbal punishment. Um, Growing up, they were kept from social activities unless they got a perfect score on a paper,
Yeah.
right? And so they wanted the love and affection from their father, and then they get into Yale. So they've taken all these skills and all this stuff, but it's generated out of anxiety, right? But they've done something as far as to get into Yale. But they come to see me because they don't know the importance of slowing down,
Yeah.
understanding how not to have their life tied to their father. They want what do you want to do? Hobbies, interests, separate from school. Well, they weren't allowed. Well, it's like, hey, you're allowed now. So that you could hear kind of for me that the struggle in terms of as we talk about trying to kind of concretize it, define it, so you could use it, right? A little bit of a program. I can offer you the beginnings of how to do some of that.
Yeah.
But when the family dynamics come into play, that becomes more tricky to
Yeah.
standardize.
Yeah.
Okay.
Yeah. I
Yeah.
think I think because like to simplify a little bit also,
Yeah. Yeah.
um in my opinion, and I don't know if you're like with me
Yeah.
with that,
Yeah.
like the modern medical treatments these days,
Yeah. Yeah.
like sometimes you don't need a lot of stuff like to get healed, or pills, or like a medicine list
Yeah.
of of drugs that you
Yeah.
have to take it.
Yeah.
I think in my opinion, like you can find your system in a small tricky stuff, small
Mhm.
tips,
Ah,
as
yeah.
as we
Yeah.
mentioned
Yeah.
as we
Yeah.
mentioned like as we
Yeah.
mentioned now, like the healing process would be going out for a walk,
Yes.
talking to strangers in a coffee shop.
Yep.
Like maybe people, if they start
Yes.
using these steps,
Yes.
they might find the answers, they might find the solutions. So definitely, like the healing process is a long journey.
Yes.
Definitely
Yes.
sometimes we need the doctor to go for
Yeah.
sure and try to put the frame for us,
Yeah.
give us some scientific stuff.
Mhm.
But sometimes it's very simple, like
Mhm.
just do what you are not doing, and
Right.
keep
Right. 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 Right.
keep the
Right. Right.
system going,
Well.
like some practices, and
Yeah.
then you can find your way. This is the conclusion maybe of like what we were talking about. But
Yeah.
yeah, but the products, like if
Yeah.
I'm offering for you like a
Yeah.
product, maybe
Yeah.
it's like much simple, you know much very simple, like as you think. So um
Well, and that would be that would be an interesting thing, right? That you could come up with a product, right, and say, hey, here's what you've learned on your journey, and you want to see how much of what your steps are, would apply to, you know, 25 people who are taking a course, um, and then you could kind of give like a, some kind of like a questionnaire test or something like that to measure certain things, and over time you probably could kind of um, figure out, what are the 5 or 6 kind of major things that help, with anxiety, mood, and so that if an individual is not doing these certain things, right, exercise and movement, would be one of them. Like the science shows, if you don't, if you're sedate, you're not moving around, you're not getting, oxygenation in your blood. It's like you're going to become lethargic and you get bored more easily, right? So the walk, it would be one of those things, and for me, movement. It's like, I don't care if it's a walk, if it's a run, a bike ride, right? But in some ways, I would say you probably, as you hit about, you probably got to get out of the house a little bit.
yeah.
And so, you could say, hey, these are the things that help most people, and so let's just pay attention to what you notice on the days that you do those things, and what you notice on the days you don't, right? And then some things, things will begin to kind of come together. Some of the contributing factors maybe are going to rise to the surface eventually, right?
Yeah,
Yeah.
I think for like as a conclusion, the most important factors is like sleep, exercise, and diet. After we
Oh yeah.
consider, yeah, this
Yeah.
is the main proactive steps that they like people
Well,
take into
yes,
consideration.
and in there, right, right. Also, we hit upon kind of, I would add that sleep, exercise, diet, and then socialization, right?
Yeah, yeah,
And you mentioned kind of the writing, right? So for me, sleep, exercise, diet, warm, as we're doing now, kind of warm human connection, and you've got some space, some process to write your
Right.
thoughts down and help you think and look at something, right? That
Yes.
would be that that would be part of the six or
Yes.
seven.
Yeah, because
Right.
like I built 7 days, like
Yeah.
7 days building confidence because I was
Yeah.
like lacking of confidence,
Yeah. Yeah.
and a recovery anxiety program.
Yeah.
Offline is the new luxury without the phone, and like
Yeah. 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 Yeah.
there's a
Yes.
lot of
Well. Yes.
upcoming services. So the
Yeah.
full
Yeah. Yeah.
system is like, even if you are not customized, or you don't know how to
Yes.
start
Yeah.
exactly,
Yes.
or
Yes.
if you don't
Yeah.
have
Yeah.
your
Yeah. Yeah.
unique
Yeah.
frame, just you can
Right.
start by these steps, and then you find out your solution and overcome the obstacles, whatever they
Well,
are.
right, and no question, and in there, right, what you could do, right, it is as you're kind of having them look at these, um, you know, 5, 6, 7 factors that go into health and wellness and healing, so to speak, right? Um, you just pay attention to what else do they notice? So, I think that, yeah, if somehow, right, if you just added that piece in, did they notice? What did they notice? And all those factors, but did they notice anything else?
Yeah, yeah,
Because then it'll give you then it'll start to hone in on kind of what would be unique to
unique to
that
them.
specific. Because
Yeah,
in a sense, that's what I kind of my issue with this. Let's just take the self help genre and kind of part of what my book tries to do, right? Is it tries to say, kind of like, as I've mentioned, along the way, hey, your well-being is like a fingerprint. We
yeah,
all have one, but they're all unique. There's certain components that are similar, but there's going to be elements that make you you and are unique and specific. And so in your system, where would you have a little room for that? So that you could have a system that says, hey, these are the 5 or 6 things, and this is what you hit, and this will help, 80 percent, 85%. Okay, fair enough. Then that's good. But for me, right, I want I want the uniqueness, a little bit of a difference. I want that component, right? So to
yeah,
me, if you could do that component somehow in regard to the system you're already talking about, to me, and I go, okay, then it's like,
yeah,
yes, and
yeah. I
yeah,
see.
yeah,
I
yeah,
see.
yeah, yeah,
Yeah, thank you so much.
yeah,
To be honest, and I enjoyed a lot the conversation.
yeah, me
Uh,
too. Yeah.
yes. Do you have any like final thoughts? Um,
Um, Yeah,
like,
I do think things that we talked about are, very helpful in the healing journey, particularly kind of the writing, because it gives you a space to
yeah,
think and then to come back and look at something in a way to kind of uh, help you think through and look at what's going on, sometimes below the surface that you don't always pay attention to. So I do
yeah,
think that's very helpful. So for me, I think kind of like the three biggest areas: kind of work,
yeah,
love, play. Right. I mean, if you kind of have those elements in there going pretty well, I do think for me that's kind of a big component of healing, because then
yeah,
with the phone aspect, you can have too much stress because of the phone, and that might mean, hey, you're not getting enough kind of time to decompression, and then that might allow you to enjoy yourself more. So
yeah,
so so, de- so, de- so decompression would be another factor
mm,
component in healing
yeah, yeah.
in today's day and age.
And this
Right.
is why the reason of like wellness equation is the title of your Substack,
Yeah.
and why your Substack.
Yeah.
Yeah,
So I have like 8 or 9, 10 factors, that I hit upon that come from the science, but how you string them together and how you pay attention to them, right,
is the key. Yeah,
is the journey. It's for as
yes,
far as what I do. You know what I mean? Right. 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 Right.
yeah.
Right.
Okay. Thank you so much.
Thank you.
And I hope for, next live session would be also as helpful as this one.
Absolutely, I would love to do another, and I enjoyed
Yes.
this.
Thank you.
And so, hey, I appreciate everyone kind of showing up. I hope everyone
Yeah.
have
Yeah, for sure. For
good
sure.
a good weekend, and that you would kind of decompress and go have some fun,
Yes.
increase your well-being equation
Try to disconnect
from the
and
phone.
yes, and reset for a new week.
Absolutely.
Yeah.
Amen. Amen. Nice.
Thank you.
All right. Thank you.
Thank you.
All right.